It's important to understand the difference between post traumatic stress or PTS, post traumatic stress disorder or PTSD, and post traumatic stress injury or PTSI. Let's break them down. Hello and welcome to the Pause First Academy channel. I'm Kim Colegrove. I'm an author and the owner of Pause First Academy, where I offer resilience and wellness training and support for society's warriors, protectors, guardians, and healers. I teach powerful personal practices that help you reduce your own stress, regulate your own nervous system, practices like breathing, meditation, and mindfulness. I do this work because I lost my own husband to suicide less than 3 months after he retired from a 30-year law enforcement career. And because of that, I learned so much about what happens when we live with unprocessed chronic stress and trauma. And I can't stand the thought of people suffering in silence. So that's why I'm here. I like to teach people about the impacts of trauma, and I also teach powerful personal practices like breathing, meditation, and mindfulness. These practices can help you reduce your own stress, regulate your own nervous system. I've been meditating for almost 50 years, and I've been teaching meditation and mindfulness professionally for well over a decade. I previously worked with organizations like Garmin International, United Way, Department of Veterans Affairs, National Court Reporters Association, and a lot of other small and medium-sized companies. So that's who I am. That's why I'm here. Now let's jump in. Okay, back to PTS, PTSD, and PTSI. We're going to break these down. Let's start with PTSD, or post-traumatic stress disorder, because it's the most commonly known. I have some notes here, so you're going to see me looking down because I don't want to leave anything out, and I don't want to forget to say anything. I'm not an actor. I could never be an actor because I would never remember my lines, so I have to have notes. Okay, PTSD is a clinically diagnosed mental health disorder that can develop after exposure to trauma. It's diagnosed based on the criteria outlined in the Diagnostic Statistical Manual of Mental Disorders, also known as the DSM-5. So PTSD is a diagnosis. Now, people throw this term around a lot. They go, I have PTSD because of this, or I have PTSD over that. And it might be something like, you know, a scary movie they saw yesterday. But this is actually a very serious condition, and it requires a diagnosis. The DSM-5, by the way, is the American Psychiatric Association's reference book, which is used by mental health professionals to diagnose mental health and brain-related conditions. So PTSD is a clinical diagnosis. Post-traumatic stress, or PTS, without a diagnosis of PTSD is similar to PTSD in that the symptoms of post-traumatic stress mimic those of PTSD. The main difference, according to mental health professionals, is severity and duration. So typically, generally speaking, post-traumatic stress will diminish over time without serious intervention, and post-traumatic stress does not significantly interfere with one's daily life long term. The thing I want you to know about post traumatic stress, or PTSD, is that you can be struggling with PTS without a diagnosis, or if you were tested or went through the process to determine whether or not you have PTSD and you didn't meet the criteria, that doesn't necessarily mean that you're a-okay, okie dokie, and that, something's wrong with you if you still don't feel great, if you're still struggling mentally and emotionally. I just want to let people off the hook with this because I've worked with a lot of veterans and first responders over the years. And, one thing that I notice in group settings, especially, is, people who are struggling will say, well, I don't know what's wrong with me. So and so over there got a diagnosis of PTSD. I don't have PTSD. What's wrong with me? it could be that you are struggling with post-traumatic stress. You were exposed to trauma or encountered trauma, and it has impacted your mental health. That's normal. It's a normal response to being exposed to trauma. So that's post-traumatic stress, PTS. Next up is post-traumatic stress injury, or PTSI. This term has been introduced in recent years to help eliminate the stigma that is attached to, mental health problems or mental illness, that people don't want to claim, and to frame the post-traumatic stress as an injury rather than a disorder. If you want to know more about what I'm talking about right now, be sure to watch my video on invisible wounds, because that's where I talk about this. What does it mean to have an invisible wound? And I do explain in that video that post-traumatic injury, PTS, invisible wounds, they're wounds on the inside. They're mental and emotional wounds. So it's not like a laceration or a burn, a wound that you can see on the outside, or a broken bone that is in a cast that people can visibly see. Oh, you're injured. These wounds are on the inside. Nobody can see them, and nobody knows that you're hurting from these wounds, but they can cause just as much pain, if not more, than a physical wound. So the reason we're tacking on the word injury to PTS is to help eliminate some of the shame and stigma, which makes me crazy. We need to completely wipe out the stigma around people getting help to support their mental health after they've been exposed to trauma. But anyway, we want to help people understand that their condition is a normal, reasonable response to exposure to trauma, and it's treatable. And also, and maybe more importantly, to help people who aren't suffering with post-traumatic stress to understand that any level of post-traumatic stress, injury, or a diagnosis of PTSD is an injury. It is a wound, and there are serious consequences and pain that occur due to these wounds. We have to eliminate the stigma around mental health injury or mental health wounds. So again, for more on that, for more on the invisible wounds, be sure and watch my other video. Now let's talk about the similarities between post-traumatic stress, PTSD, and PTSI. All of these can be caused by trauma and exposure to trauma. Trauma means deeply distressing or overwhelming events that overcome a person's ability to cope, negatively impacting their mental, emotional, physical, and even social health and well-being. Direct exposure to trauma can cause post-traumatic stress or PTSD or PTSI. But secondary trauma can also cause these conditions. Secondary trauma means being exposed to and impacted by the trauma of others. So people across these professions that I work with, the warriors, protectors, guardians, and healers, are exposed to other people's trauma regularly, sometimes daily. It's important for you to understand that secondary trauma, the symptoms of secondary trauma mimic the symptoms of trauma. It doesn't matter whether or not the trauma happened to you. Witnessing the trauma of others can cause the same conditions, and that can impact your mental and emotional health. I want to give you a list of events that could be considered traumatic events. Traumatic events include, but are not limited to, the following: witnessing or experiencing trauma, physical or sexual abuse, neglect or abandonment, natural disasters, accidents, losing a loved one, or exposure to war or conflict. This is not the fulsome total list, but this gives you an idea of things you may have experienced, encountered, or witnessed in your life that have caused you trauma. Now I want to share with you a list of common symptoms of trauma: fear, anxiety, panic, hypervigilance, intrusive thoughts, startle response, nightmares, sleep disturbance, emotional numbing or detachment, avoidance, irritability, anger, risky behavior, reckless or impulsive behavior, guilt, shame, sadness, hopelessness, depression, fatigue, difficulty concentrating, memory loss, rapid heartbeat, heart palpitations, lack of intimacy, lack of trust. Again, that's not a fulsome, complete list, but this gives you an idea of these are very common symptoms of people who are experiencing trauma. So think about how many of those you might be dealing with. And part of why I'm doing these videos and part of why I want to have these conversations with you is to encourage you to look inside, a little introspection, because what will harm you more than anything is that power on that people tend to do. Just autopilot, survival mode, plow through, I'm fine, I'm fine, I'm fine, I'm good. That is called ignoring your trauma. If you go on like that for a decade or 30 years, you're living with that unprocessed trauma. You aren't even honest with yourself about it. You don't take a look at it. You don't do anything to process it or heal it. It can really cause you problems mentally, emotionally, physically, and in your life, in relationships, and at work. So hopefully I can encourage you to slow down and look inward and consider some of what I'm talking about today. Let me tell you why I want you to know this. Because many of you are suffering with the symptoms of trauma, and many of you love somebody or work with somebody or are friends with somebody who is suffering with symptoms of trauma. And I want you to know that help is available. I want you to ignore stigma. I want you to know that post-traumatic stress is a wound and it's treatable and it should be treated just like any other wound, like a broken bone or a burn or a cut. What I offer personally, my piece of this is I offer personal practices that can help you reduce your own stress, regulate your nervous system, learn how empowering self regulation is. So, I teach these practices that help you increase self care mentally, emotionally, physically, increase your self care. And that helps build your resilience because the more you build your resilience, the more fortified you are when you inevitably encounter these threats and traumatic events in life. Now, you may or may not be ready to learn these powerful personal practices yet. You might need a bit more of an acute intervention first. And if that's the case, please take a step. Peer support, talk to a trusted friend. Maybe you're ready for a therapy appointment. Do something, take a step. Maybe you need intervention for an addiction, whatever it is. If you're not quite ready to learn these personal practices because you're honestly not in very good shape, I encourage you to take a step today. Now, I'm not a doctor, I'm not a mental health professional, so please don't take anything that I'm saying as medical advice. But I will tell you, if you're watching this or you're listening to this and you're not in great shape, like you're not doing very well. One thing that I can offer you right now is my warrior resource list that's available on my website. It's a downloadable PDF. It's absolutely free. And on the first page of this resource directory, you will see crisis numbers. If you are feeling at that level and you need maybe a crisis intervention, then please go download that and print it off if you can right now. If you can't do that, you can go over to my website. And if you scroll down to the bottom, pausefirst.com, P-A-U-S-E, first, F-I-R-S-T.com. If you scroll down to the bottom, you'll see crisis numbers there. If you don't quite need a crisis intervention, but you're not quite ready to just learn, breathing, meditation, and mindfulness, you need something in between, then please go download that directory. It's free, doesn't cost you a dime, and it is filled with resources, ideas, articles, books, facilities if you need one, and just anything and everything you can think about. This gives you a confidential way to go see what's available. And these are the interventions and the resources that your peers are using. I've extracted everything that's in there. I pulled from the 2 dozen people that I've interviewed for my books. I've pulled a lot of it from the books. I had some help creating that directory. I've done my best to vet everything that's in there. And that might be a good first step for you. Now that you're facing your trauma and you're admitting, like, oh, I'm doing great, do something. Take one of these steps. Everything I mentioned in the video today, I will include in the description box below the video. Now, I know some people get confused about this description box, where to find it, how to get it to expand. So if you look just below the video where you see the title, you'll see ... more. You want to click on that ... more. And if you're on your phone, you might have to click on that and then look down towards the bottom and you'll see ... more again, and that will fully expand or open up that description box. So anything I mentioned today, any links, any resources, I'll make sure all of that information is in that description box. I hope this information is helpful for you. If it is not you that's struggling with these issues, but it's someone you know, I hope you'll share this information with them. We need to turn up the volume on this conversation. If you're enjoying my content, I would really appreciate you do all the things. You know, you probably get tired of YouTube people begging you to do all the things, but that's the only way we can grow our channel, get this information out to more people so we can help more people. So just like tapping the thumbs up, that's huge. Subscribing, that's even better. That helps tell YouTube that, you know, people are watching these videos and liking these videos, and then YouTube will push them out to the right people. So I really appreciate you doing that. Also, if you don't want to miss any videos, I've got a whole bunch of stuff coming up. I'm going to cover all the stuff that I've been talking to people about for the last decade or so. So if you don't want to miss any of my videos, when you subscribe, also tap that bell, and then you'll get a notification every time I release a new video. And I hope you'll go over and take a peek at Pause First Academy. It's academy.pausefirst.com, and I always have something free over there. So let's say you're just interested or curious. I have a free meditation course available over there, absolutely free. It's yours for 90 days. You don't have to spend a dime. It's called Demystifying Meditation and Mindfulness. So go check that out and, you know, poke around, see what we got over there. One more thing, if you enjoyed this video, then be sure to check out the video you see on the screen right now. You can find my books on Amazon or at book retailers worldwide. And if you're enjoying this content, come on back. I'd be happy to have you back. I appreciate you. Thank you for being here, and I will see you next time.